Hi, thanks for joining me today. We're going to continue our discussion about heart disease. And one of the questions that comes up is, what are the options available in terms of its treatment? Most people would think that, you get diagnosed with high cholesterol, therefore, heart attack worries. So we take the medication and we run with that until one day we have an event like a mini heart attack, or we get on the treadmill test and we find that the heart isn't pumping too well. And then suddenly, of course, we might need an angiogram followed by potentially a stent or a ballooning or a triple bypass. I see the progression of this a little bit differently, and I want to share that with you. My feeling is that, and this relates to the prevention issues, I think that the first step, if we have any worries about our cardiovascular situation, is to get a CT scan done. Now, what a CT scan, what it does is it detects calcium in the arteries. Calcium, even though we don't think of it in terms of being a metal, it shows up on an X-ray because it is a type of metal. And so that's why if you break your leg, you get an X-ray to look at the breakage. And a CT scan basically takes a number of pictures of your heart and the blood vessels around the heart, and detects the calcium that is there, and using some computer calculations determines the sort of general buildup in that area. And so to me, I think that's a starting point at some stage. If we're worried about it, say we're 40 years of age and we have a concern about heart disease, well, I think it's worthwhile then to consider that as a treatment step. It's not very difficult to do. You just go in and there for a couple of hours in total to see how your arteries look. Now, if there's a buildup of calcium, then obviously we need to go to stage 2 to dealing with that. The fact that we pick up calcium tells you something, because even though people talk about buildup of calcium in the arteries, it's actually not true. Most of it is the question, I'll just repeat that. The people think in terms of the buildup of cholesterol in the arteries as being the concern. The real issue is that we see calcium buildup in the arteries. So calcium is the problem. It's not cholesterol. And the beauty of calcium, however, is that we can remove it. And so if I had a CT scan and there was calcium buildup there, then the next step would be to say, okay, how do we remove it? And there's a treatment which is considered quackery by a number of doctors who don't understand it, and it's called chelation therapy. And what chelation does is it seems to have a very strong effect on cleaning up the arteries. And the way it works is you go to a doctor's office, or it could be a naturopathic physician. I think in the United States you have those, where intravenously they run a particular solution through the arteries, and you go probably 10 or 20 times, and what it does is it pulls any metals, heavy metals, any metals off the arterial wall, and therefore starts to reduce the buildup of material that can contribute to arteriosclerosis. And so you would get that treatment done. And it was interesting, I had an example of a good friend of mine up in Canada who was having some difficulties with his cardiovascular system. So he went to the doctor, and the first doctor was a surgeon. And of course, what do you think surgeons do? Well, they do surgery. And so this surgeon said to him, oh, listen, I can fix the problem. In his case, my friend was in his leg, okay? He had some poor blood flow and it was affecting his walking and playing golf. So the surgeon said, what we're going to do is, it's like a bypass. We're going to take some vein from another part of your leg, and we're going to bypass the blockage, and then the blood will flow, and then your leg will be as good as gold again. Now my friend, of course, wasn't that enthusiastic, firstly, of the fact of getting someone to start cutting into your arteries into your leg. It wasn't too excited about it. And secondly, he was smart enough to realize that would bypass one of the blockages, but if you've got one blockage, you've probably got a whole bunch of little blockages at the remote points, very minute blockages, which a surgeon cannot get to. And therefore, you're effectively temporarily fixing one blockage but not dealing with the total situation. Anyway, he thought he'd get another referral. So then he goes to another doctor who's a cardiologist who doesn't do surgery, but who can do angiograms and put a catheter, up through the leg, through the blood vessels to the heart or down to the leg, and they can use a balloon and put a little stent in there. Everyone's familiar, I think, with the stent, and somehow open up the blocked area and allow the blood to flow. So once again, my friend wasn't too enthusiastic about getting a piece of metal put into the artery in his leg, so he thought he'd see what his other option was. And then he found another doctor that did this chelation therapy. So just to summarize, we've got 3 doctors. One's a surgeon who does surgery, one's a cardiologist that uses a catheter, and the third one is a normal doctor that does chelation therapy. Okay, all of them treating the same condition 3 different ways, and I hope that it tells you something about disease conditions and how they can be addressed in different ways by different practitioners. The patient better be smart enough to work out which option that they think is best, because if they get it wrong, they might pay a pretty hefty price. Anyway, he goes to the chelation treatment. He goes there with this computer, sits there, watches the computer, watches television, spends an hour and a half there with this intravenous drip to clear off this debris, this arteriosclerosis off his arteries, and he's back playing golf again and able to walk, and the problem is fixed. So to me, chelation therapy, I think, is a very powerful stage to consider to remove some of the arteriosclerosis problems that are there. And that should be a step, I think, before anyone got anywhere near putting bits of metal in your arteries or a triple bypass, one really should look at chelation as being the optimal treatment or intermediate step, and one may never ever get to these endpoints of bypasses. In my case, I've always felt, I've got my very high cholesterol, as I mentioned to you before. In the American system, I'm sort of up around the 400 something, and in the Australian system, I'm around about 10.5, which is high. If I ever feel any signs of any angina or any slowdown in oxygen and so on, then I'll get chelation therapy done. I've not had to use it to date, but to me that would be the logical next step in my life if I ever get to that point. And certainly the idea of having stents shoved up into my arteries or triple bypasses is something I want to defer to a late stage and hopefully never have to deal with at all. So I think chelation is a very attractive thing to consider, and I would certainly encourage you to explore that. There are many wonderful practitioners, medical doctors and like, who do it. But yeah, they're probably 1% of the population. There's 99% who think it's quackery. The amazing thing I found was, I remember once I was talking to a doctor, and I put her to the test. I said, tell me, what do you think about chelation therapy? She pondered for a moment, and she said, listen, I don't really know what it is, but what I've heard is that it's quackery. I thought to myself, well, this is great, isn't it? Here we have a doctor who doesn't have any idea what chelation therapy is. It's not part of their standard training. And all that she's heard from her lecturer at university is that it's quackery. Well, it's not quackery. It's probably one of the most wonderful treatments that are available. The risk of it is very, very low. Certainly the side effect risks is far lower than getting stents or angiograms and so on. But the upside is quite significant, and I know it's also used. There are people who have severe arteriosclerosis caused by diabetes, for example, where they've been about to have their leg removed because of this severe buildup, where chelation therapy has fixed the gangrene condition in the leg, and where suddenly they're walking on that leg again, going to work, and yet they could have faced losing that limb if they had followed the standard treatment. So I'm going to say it once, and I'm going to say it again in the future. Don't rely on the opinion of a single doctor when you've got a life-threatening diagnosis. Think outside the box. Go and talk to a traditional Chinese practitioner. Go and speak to a naturopath. Go and speak to an osteopath. Get your facts together and make an opinion based on fact rather than on one person's opinion. Okay, see you next time.